Welcome back to The Talk Tonight. Fallout continues from a major medical mistake at St. Joseph's Hospital 4 years ago. The hospital is now making changes after a woman woke up as doctors were preparing to harvest her organs. A post-standard investigation turned up records that shows doctors ignored a nurse's observations that the woman was responding and trying to breathe on her own. This story has since spread across the national media, being featured on CBS News and the New York Post. Tonight, we are joined by Rob Kochik, Executive Director of the Finger Lakes Donor Recovery Network, to learn a little bit more about the organ donation process. And thank you for being here tonight, because I think that there's a lot of concern in the community when they see the headline of what has happened at St. Joe's. Do you all get inquiries in light of cases like this?
Well, first of all, I just want to thank you, Megan, for having us on this evening, and for us to recognize the staff at St. Joe's who gives care to patients and tries and saves everyone's life every single day, and to the family who was involved. And I'm sure you know that I can't really speak specifics, but hospitals follow laws actually from Medicare and for Center for Medicare and Medicaid Services to refer patients at or near their time of their death, depending on what their neurologic function is, to our program. And we work with St. Joe's along with 37 other hospitals in our service area to evaluate patients at specific, just very specific times to determine whether or not donation is possible.
I would think that a case like this might cause concern among some people and make them question whether or not they would want to donate, which I think actually is really quite unfortunate, because organ donation can be a wonderful thing. What do you say to people who may be hesitating on whether or not they would want to be an organ donor in light of a situation like this?
Sure. Megan, what we find is that when individuals, and it's a very individual, personal decision, some of it is based on fact, and some of it is based on our emotions. And I think two things that we hear out in the community is, one, people often say, I'm too old, or you don't want my organs because I have this, or I have that, or I have something else. And we say there's no upper age limit. We encourage everyone to enroll in the registry or sign their donor card so that at or near the time of their death, we can make that determination. The other common question and concern we have is that someone says, I'm a little concerned about having that hard on my license or signing a donor card because I'm concerned that the doctors and nurses aren't going to take care of me when I get to the emergency room. And we know, I'm a nurse as well, and we know that every doctor and every nurse at the hospital's first priority is to save every patient's life. And, they're not looking to see whether or not you've signed your donor card.
How common is organ donation? How many do we have here in the region?
Sure. Well, I think everyone thinks that there must be many patients who could be organ donors.
I would think maybe thousands in the last year we might have had around the central and northern New York region.
Sure. And in fact, last year, during calendar year 2012, we helped coordinate 38 organ donations, and those patients were able to donate organs that can help about 100 patients. So it's pretty rare when you think of all the patients that die either inside in the hospital or outside the hospital. Organ donation is a pretty rare event.
Why is that? Why do you think the numbers are so low? Do you think that there are a lot of misconceptions out there? Are people fearful of it? Is there just not enough awareness?
Well, it's really speaks to patients can only donate their organs if either A, they have lost all of their neurologic function and they've been declared legally dead based on specific evaluations and examinations that physicians have done. And statistically, only 1 or 2 out of every 100 patients that die in a hospital die that way. The other way is if someone has lost much of their neurofunction, the doctors and nurses have conveyed to the family that their loved one will not recover, and the family, based on the patient's wishes or what they think their loved one might have wanted because they never had those conversations, will make a decision to withdraw support. And only in those cases, if the patient dies in a certain period of time, we're possibly able to donate some organs.
Well, certainly it's a good opportunity for all of us to learn a little bit more about organ donation. Rob, thank you so much for taking the time to speak with us tonight. We appreciate it.
Thanks, Megan.
All right, coming up.